This is the most common reason given by the residents who had quit their surgical residency. Finally, the NEET PG has been conducted. We are eagerly waiting for our juniors all these days. Today, we are going to talk about a very important topic, that is the recent change in the trend over the years where people are preferring to choose medical branches over the surgical branches. It is true that most of the topper students prefer to take medical branches, and there are very less students who would be choosing surgical branches. This has been the trend from many years. But the issue is not that. People who are taking up surgical branches are actually dropping, and they are taking a re-exam and going into medical branches. This is the new trend. Let us see deep into this. What are the actual reasons for this thing? High expectations. Students are coming with very high expectations, thinking that they are going to operate from the minute they are joining the hospital, and they are going to get unsupervised hands-on experience. But that is not the situation. You need to really understand the branch here, because operating someone requires a significant amount of expertise and also a decent amount of training, which would be definitely taking a good amount of time. Understanding your department. You really need to give some time for the acclimatization, and you need to really understand your department, the way it is functioning, and how the growth is seen in the years during your residency. This usually takes about an year to actually get the whole knowledge, and you should not definitely jump into any conclusions before actually spending significant amount of time in your residency. Comparison with other departments. This comparison with the other departments of the same hospital and also the different hospitals should be avoided. This actually creates more problems. In fact, you actually should be owning the department and give your 100% for the department and work like as if they are your own patients. Then only actually you will be seeing a growth in the career, and that is the way you are going to fall in love with the subject. Worrying about hands-on. Often people actually worry about the hands-on looking at their seniors in the first 3 to 4 months of their residency program. This should be completely avoided, because no institute is going to offer you hands-on without actually assessing your clinical acumen, making of diagnosis, patient handling, and anatomical knowledge. This will gradually progress with your residency. So you need to give a considerable amount of time before actually jumping into any sort of impulsive conclusion. Difficulty in handling the workload. This is the most common reason given by the residents who had quit their surgical residency. At this time, you need to actually keep in your mind that while you are choosing that particular institute, you actually chose it for its high workload. There is a simple rule in surgery: more the number of patients, more is the hands-on. So hopefully, I think this must have answered most of the questions who are going to take the surgical residency in NEET 2024. Thank you. Keep subscribing.